Calpol Oral Suspension is a commonly used over-the-counter medication that contains paracetamol as its active ingredient. It is a pain reliever and fever reducer, often used to alleviate mild to moderate pain and reduce fever. The active substance in Calpol Oral Suspension is typically paracetamol, also known as acetaminophen. Indications: Calpol Oral Suspension is indicated for the treatment of the following conditions: relief of mild to moderate pain, e.g. headaches, dental pain, menstrual cramps, reduction of fever associated with various illnesses, such as colds and flu. How to use: shake the oral suspension bottle well before use. The dosage for Calpol Oral Suspension may vary based on age and weight. It is essential to follow the dose instructions on the packaging or those provided by a healthcare professional. The typical dose for children is based on their weight and age. For adults, the dosage is generally 500 mg to 1000 mg per dose, with a maximum of 4 doses in 24 hours. Contraindications: Calpol Oral Suspension should not be used in the following cases: non-hypersensitivity or allergy to paracetamol or any of the product's components, severe liver disease, severe dehydration. Special instructions: follow the recommended dosage and do not exceed the maximum daily dose to avoid potential liver damage. Don't use other paracetamol-containing products concurrently to prevent accidental overdose. Consult a healthcare provider if the symptoms do not improve, worsen, or persist after using Calpol. Keep the medication out of reach of children. Side effects: Calpol Oral Suspension is generally well tolerated when used as directed. However, in some cases, individuals may experience side effects, which can include skin rash, nausea and vomiting, allergic reactions, rare, liver problems, rare, but can be serious with overdose. If you experience severe side effects or signs of an allergic reaction, seek immediate medical attention.